Sweet. So we're dispatched to a 19-year-old male with a chief complaint of shortness of breath and abdo pain. On entrance, I completed a quick primary and secondary survey. The patient presented hypotensive tachycardic and had a fever, so I'll be completing a full respiratory and abdominal exam.
Hey man, what's been going on today?
Man, I'm feeling pretty short of breath and got some pretty bad tummy pain.
Yeah. When did this happen?
About like half an hour, 20 minutes ago.
Half an hour, 20 minutes ago. And what were you doing when the pain came
I was
on?
just having dinner with the family.
Yeah?
Yeah.
Having dinner with the family. Okay. And I see you've got some abdo pain. Whereabouts is that pain?
It's all over my tummy, all over the place.
Yeah. And how would you describe it? Like?
It's quite like achy, I'd say. Like a dull achy pain, yeah.
Aching pain. And what would you put it out of 10? If 1 was no pain, 10 the worst you've ever felt?
I'd say like a 6 out of 10 at the minute.
6 out of 10?
Yeah.
Okay. And so obviously you've got abdo pain the time. Does anything make that pain worse?
Yeah, when I'm throwing up, it makes it quite sore.
So you've been throwing up?
Yeah, like three or so times since I had dinner. Yeah.
Okay. And what does that make your pain scale when you throw up?
Like an 8 or a 9.
Pretty bad, eh?
Yeah.
Okay.
Quite sore.
And tell me about that vomit. Is it quite normal consistency?
Yeah, just food and stuff. Yeah.
Just food. And any blood?
No blood or anything in there.
No blood in it. And what have your bowel motions been like?
I've had one since dinner and it's been quite runny.
Yeah.
Yeah.
Okay. And is that just quite runny? Is there any blood in that either?
No blood.
No blood
at all.
Okay. And your urine, like passing water, has that been pretty normal?
That's been fine. Yeah.
No pain.
No
normal
pain.
colour.
Yep.
Okay. And what did you have for dinner? What was the last meal?
Chicken peanut satay.
Chicken peanut satay. And have you had it before?
No, first time.
You haven't. And did everyone else have that meal as well?
Yeah, everyone else in the family had that as well.
And how are they? Is anyone else feeling a bit sick?
They're all feeling alright. Yeah.
They're all feeling okay.
Yeah.
All right. Okay. So, and have you taken any medications? Are you on any medication?
No, I'm not on any medications.
No. And any alcohol or drugs today?
No, nothing like that.
No. Sweet. So now I've finished some questionnaires. I just want to do a quick physical examination of your abdomen. So it just includes just a palpation. I need to look and also listen. Are you comfortable with that?
Yeah.
Sweet as. So I'll get you to pop up your shirt. So the first thing I'm looking for is any scars, any bruising, which can indicate pancreatitis. Scars, bruising, jaundice, which can indicate liver disease. Any discoloration or ascites, which can indicate fluid retention. So I'm just going to have a quick palpate, if that's all good. So I'll just work from across here. Just palpate all around all the core tabs. So what I'm feeling for is any hard masses, which could indicate a hernia. Also feeling for, looking for any rashes as well. And also any rigidity or tenderness. And if there's any rigidity, it could show that he's guarding and that he is actually in pain in that area. And next thing I just want to auscultate just to listen for any gurgling or rumbling. So let's pop those in. Awesome. So that's all sounding okay. The amount of bowel sounds you want to hear in about a minute is about 5 to 35. If it's below 5, it can indicate a hypoactive bowel, and over 35, a hyperactive bowel. And then we also want to percuss, just to have a quick listen if that's okay. So over the liver, it's quite common to hear dull sounds, and everywhere else sounded okay, so I'm happy with that. I'll now move on to the respiratory questioning. So we're just going to work through a respiratory assessment now. So how are you feeling?
Quite lightheaded, a little bit dizzy. I also feel like my tongue's kind of a bit swollen. It's kind of hard to swallow.
Yeah, and you seem a little bit short of breath as well.
Yeah, definitely.
So from my general impression, he seems quite short of breath, a little bit flushed in the face, and also a little bit sweaty. I'm also looking at his work of breathing. He's obviously tripoding, so it's helping him with his shortness of breath, and I can see a little bit of use in his accessory muscles. He does seem a little bit fatigued as well, and but his circulation to his skin is quite good, and he seems well perfused. When did this happen? When did this start?
So it's sort of the same time as the
As the
food,
food,
yeah,
yeah.
my stomach started getting sore.
Okay, so about 15-20 minutes?
Yeah, about that.
Okay, and do you have any medical history?
No,
No medical history?
not that I'm aware of.
And have you had any trauma recently?
No,
No. And any allergies?
not that I know of. No.
Okay. And are you on any medication? I said earlier, didn't I? Do you have any allergies?
No,
Not that you know? Okay. And this hasn't happened before?
no, not like this. No.
Alright. And does anything make it worse or better? Like, is it getting worse, do you find?
Yeah, I feel like it's getting harder to breathe.
Getting slowly
and harder to
progressing.
swallow as well.
Alright. And have you been coughing up any phlegm?
No,
No. And any recent coughs or colds?
no, I've been pretty well up until today.
Okay. Next thing I want to do is just a quick respiratory assessment.
Yeah.
It's all good. Okay, so the first thing I'm going to be looking for is just anemia. So if I just pull your eyelid down a little bit. Yeah. Okay, there's no anemia. Checking for nasal flaring, central cyanosis, which both come back negative, and also angioedema. There's a bit of angioedema. I'm now looking for accessory muscle use, which there is a little bit of that, and also tracheal deviation. So I'll just feel down the trachea, and I'll get you to look to your left, please, just so I can check for jugular venous distension. It's all okay. Awesome. So I want to just check your chest expansion. So I'm just going to put my hands here. So you take a deep breath in. Okay, so that was equal. My thumbs move the same. So the same on the back. Yeah. Awesome. Thank you. So now we've done that, I also want to check the hands. So what I'm checking for here is peripheral cyanosis, and that's all good. I'm checking for tar staining, which is a sign of someone's a smoker, and also clubbing of the ends of their fingers, which is a sign of chronic hypoxia, caused from like heart failure, COPD, tremor, and also carpopedal spasm is what I'm checking for, which I can't see any of that, and that is just caused from too much O2 or not enough calcium. Next thing I want to do is auscultate your chest. So I'll just get you to pop your shirt up if that's okay with you. And I just want to check all the lobes. Okay, so what I found from that was some bilateral wheeze, and the bilateral wheeze can be associated with asthma, COPD, or anaphylaxis. Some crackles, there wasn't any crackles, but crackles can show a sign of pneumonia or a pulmonary embolism, and fine crackles can show signs of a pulmonary fibrosis. And then a high-pitched stridor, which I'll just check for now because I haven't checked for that yet. So let's get you to take a deep breath in for me, please. Awesome. And one more. Let's do this. Hear any stridor? I can't hear any stridor. I don't think it's pertinent to percuss the lungs, but a dull sound from the percussion can indicate a collapsed lung or effusion. And also posterior, the same thing. If you hear a dull sound, it can insinuate a lung collapse. And a pneumothorax can show hyperresonance. Right.
So from the questioning and assessments that we completed, I believe it's anaphylaxis. This is due to the patient expressing angioedema, having a bilateral wheeze, and affecting two systems, so the gastrointestinal system and respiratory. Also, the patient had a fever, and it sounds like an allergic reaction.